Hey guys, Jason Dars here. Today I'm just going to show you through one of our signature sort of lower back treatments. So just giving Dars a bit of a tune up, so we thought we'd get the camera on and show you how we treat it. So we have shown this before, but yeah, I just thought I'd show you again. So we've started in where the lower back attaches onto the pelvis. So that's our lower back money spot. So it's the spot that we go to for a lot of lower back pain. There's a lot of nerves that exit through that area. There's a lot of fascia, a lot of muscles that attach on there. So it can be the key to fixing a lot of lower back pain. So we're gonna get in there. So we sink in slow, allow that tissue to soften and allow that elbow to sink in. Wait for Dars to take a couple of breaths. And we're just slowly getting into that depth that we need to. We're not pushing straight in. It's not a matter of how hard and how fast can I get in there. We're getting to that depth, but you've got to get in there slow, and we're allowing you, if you are getting this treatment, to receive that pressure. And you'll know it feels like a good pain. And we're staying right in close to the spine and that junction of your sacrum as well. So if you can see in there, Mikey, on the camera, we're trying to angle in there, and I'm trying to pretty much going on that 45, hitting in close there. That's a good shot there. And you can get a lot of referral pain down the back of the leg, into the glute, down the calf, round into the front of the hip. There's a lot of referral pain from this spot, but it can be gold.
Can just about fix anything from the hip down, hey Jace?
Yeah.
Groin issues, glute, hamstring, hip.
Yep, for sure. So we just like to sit and hold this spot here. We're not moving. I'm just changing my angles. So I'm angling back in that way. I'm pivoting, angling down. And we're getting communication from Dars as well, where he feels it more. So if I lean over and pull back, he might say, nah, more straight down. So it's not big movements, it's just subtle, like even just there, rotating my elbow and forearm, I can hit a different aspect of it. And we're just trying to find that spot where you go, yep, that's my pain. And we want to sit on it and just hold it. So, and then we're just slowly working our way out around this iliac crest. So staying on top of it, and we're almost like chiseling under it. So imagine all these lower back muscles are really tight, attaching onto there. We're trying to chisel in and clear them away from that ridge. So around here, if you come over the bones here, Mikey, so we're working around here. So we've started in, our money spot is in here, angling in there, and then we're starting to work out and scoop around the top of there. And then with our glute strokes, we're normally under that lip there. And then I'm just tracing around. There's normally a second money spot as well, just as we get to the outside of the erector spinae, which are the muscles here you can see on Dars. So they come in and attach down there. As I get to the outside of there, I can pull back in. And that'll almost get a bit of QL as well, so quadratus lumborum. And there's another good spot in there. And we can just sink in, get a bit more into it, and give it a good old.
As you can see, Jace can put a fair bit of force into the lower back. The back's pretty durable. You can get up a little bit ginger to begin with, but over the next day or two,
you'll feel great.
You're going to feel good. Your movement, that pain.
A lot of people are scared about getting their back treated because they've had that pain, but it's what you need. You need to get those blocks cleared out, and then you need to strengthen it. Strengthen the appropriate areas around there. Alright, and then I'll sink out of there, and then we'll do one big stroke clearing up here. So we can I'll start with a bit of a broader one. So another nice one we can do, so we can chuck in a little bit of a nicer one here. So I can just start in that lower back, a bit of a palm, and then under here, I can just almost act like I'm doing a bit of a mobilization of the spine. And it just feels a bit nicer. It's a bit of a warm-up stroke after just getting a bit brutalized there. Can be a bit nicer to receive, but I'm also just feeling for where there might be any stuck spots. Any tight tissue that I can go back to and focus on. Particularly if I get up to this point here, so where your sort of lower thoracic and upper lumbar meet, that junction point, a lot of people tend to hinge in there, particularly if you've got that anterior tilt in your pelvis, where you're like that, and then you really overextend through that mid back. That can cause a lot of jamming and compression in here. So this spot here, we can just sit there even and mobilize it. So I'm just pulling that hip up and almost pushing down the other way. And then I can also clear it up that way. And then I might feel a good spot there. I might even put a bit of a bounce in.
Oh yeah, it's good.
Yeah. Clear it up.
No better treatment than getting your lower back treated.
No, it feels great. And then we'll get one more with the elbow. So yeah, we normally spend obviously a bit longer on that money spot, but I just want to show you a few of the key strokes and key points.
Yeah.
So again, I'm almost sinking back into that money spot, but this time I'm going to be working up.
Oh yeah.
Then if I want, I can rest my hand here and add like a bit of a counter traction there. So it'll get a bit more of a fascial stretch as well as treating into that depth.
It's good.
And then just when I feel a sore spot, I might stop. I might park it there. I might pivot my elbow and perform a bit of a scoop, so clear away from the spine.
Yeah.
Then I can move on once I feel it clear up. Getting back up into that junction point. And then what I can do is I can actually trace out around this bottom rib. There's a lot of people with that anterior tilt and compression in that lower thoracic. This spot here can be a really good one. And up under there. Oh, nice slow breath there, Das. So I'm staying connected, I'm not lifting my pressure up. It's a consistent pressure, so Das can get used to it. He can take a couple of deep breaths and go, okay, I'm used to it now. And then I'm clearing it out. Stay connected. As long as you stay connected and stay at that same depth, the person on the table can accept that pressure. It's if you lift up and then push back in, lift up, push back in, where if it's more of a consistent pressure, it's a lot more therapeutic.
Oh yeah.
And then we'll sink out there. Alright, so there's just a couple of quick examples of the way we treat the lower back. There is a bit more to it, but yeah, we'll leave it there for today. Thanks guys.